We have some anatomic charts here to better describe what it is we're trying to do and what kinds of problems the balloon procedure can actually help. So once we've identified the patient who is a candidate for this procedure, we determine which of the sinuses are involved. And let's look at those sinuses here to learn a little bit about the anatomy of the sinuses. Here's a guy with a cutaway to allow us to see inside the nose and sinuses. This is the nasal cavity here, with the nasal septum in the middle. The maxillary sinuses are in the cheekbones. It's a bony enclosed cavity. The frontal sinuses are in the bones of the forehead. And again, there's bone in the back, bone in the front, and the space itself is normally filled with air. The sphenoid sinus we can see way in the back on this picture. The sphenoid sinus, here's the tip of the nose. It's in the very back of the nasal cavity. The back wall, there's an opening that we can usually find into the sphenoid sinus. Note that all of these sinuses, the frontals, maxillaries, and sphenoids, have an opening that's made of bone covered by a layer of something called mucosa. Mucosa lines all of our inside structures, whereas skin covers our outside structures. So we actually can pass a balloon into those openings and dilate them. Sinuses have to do two things to function normally and to be healthy. They have to ventilate, meaning the air within them has to be equalized and flowing freely with the atmosphere around us. And the mucus that's produced within the sinus has got to be able to drain freely out of that sinus. If one of those two functions are compromised, people are going to have pressure symptoms, they're going to get lots of infections. So for example, here's a picture of a maxillary sinus, in this case the right maxillary sinus. This pink lining is the thickened lining that we typically see in a sinus that's inflamed. Notice that it's also filled with fluid in this case. And the opening of the sinus is extremely narrow to the point where there's really no air entering that sinus. So this is a sinus that can easily get infected if bacteria find the way in. So what we do is we will actually pass a balloon into that natural opening. We'll dilate it, and not just the mucosa, but the bony segments will dilate. We then take the balloon out, and you can see that that passageway, which before was pinched closed, is now open. Because we're remolding the bone itself, we anticipate and expect that these results will be long-lasting, hopefully lifelong lasting. We can do that same dilation procedure going up into the frontal sinus. This is an example of a frontal sinus that's been dilated. We can see a nice wide opening which will allow drainage and ventilation. The sphenoid sinus also can be dilated. If it's pinched closed, sometimes we don't even find an opening and we have to create one in the region of the natural ostium. Remember, the nose is totally numb while we do this, so people should not feel any pain during the procedure. We can open that up to allow, again, free ventilation and drainage. So that's basically how the balloon procedure works. In our next segment, we're going to see some live surgery of a patient undergoing the balloon procedure. And for the third segment, we're going to interview some of our patients and discuss what their experience was like, what was life like before the procedure with their sinus symptoms, and what has changed since they had their balloon procedure.